Hi, I'm Dr. Boye, founder of Bloom Clinic. In this video, I'll be showing you treatment of excessive underarm sweating with botulinum toxin, popularly called Botox. Axillary hyperhidrosis, which is another name for excessive underarm sweating, it's a very common condition, and I hope this video shows you how simple and safe this treatment is with Botox, yet extremely effective. Hope you enjoy. To ensure the client is comfortable and pain-free during treatment, a numbing cream is applied prior to treatment. Next, I carry out the iodine starch test to identify the areas that I need to treat, and particularly the areas where most of the sweating in the underarm occur. Next, that area that have been identified are mapped out with a skin marker, and what I like to do is mark this out as two rings. The inner ring is where most of the sweating occurs and needs more of the Botox injection, and the outer ring are the adjacent areas that I still want to treat to ensure patient has a long-lasting result from their treatment. This is now the Botox being injected. Excessive sweating using Botox requires a very precise placement of Botox in the skin. As you can see with the injection, there seems to be a blob of skin being raised. This shows that the Botox is delivered in the right place. And this is also the major difference between wrinkle treatment with Botox and excessive sweating treatment with Botox. With wrinkle treatment, the injection goes way under the skin into the muscle required. With excessive sweating treatment, this injection has to be placed right within the skin. If placed in the wrong place, though it won't harm the client, it will not result in effective control of excessive sweating. And I think this is often the reason why some people have said they had treatment and it did not seem to work, because the Botox may have been placed in the wrong place. Sometimes the skin can be so thick or so thin that I occasionally use ultrasound to actually determine the thickness of the skin so that it can help me before treatment to know how far or deep or superficial the injection has to be. So the injection continues with me carefully mapping my way through the grids that I have marked out so that I don't skip any. I love to do hyperhidrosis treatment with Botox because there is virtually no downtime with the treatment. You can literally have the treatment and go back to your next activity without any worry or concern. And there is a very gratifying result from these treatments. In my practice, I've seen different people and the different effects this condition is having on their quality of life. I have seen engineers who complain that they cannot hold objects at work because of sweating of their palms, businessmen who are so worried about social events because of their sweating, and particularly they are worried that their socks smell. Many ladies that are my client complain that they can't wear the clothes that they like because of the patch excessive sweating of the underarms causes. Now we've done the right side and you can see me, I've moved to the left side. This side is treated in the same fashion as the right side, that is, anesthetic being applied to numb the skin, iodine starch test being done to mark out the areas to concentrate on for the treatment. The areas are marked and divided into grids to ease the injection and to make sure treatment is properly carried out. And the Botox, of course, is being injected now, as you can see. Still talking about excessive sweating treatment with Botox. A lot of questions people ask me is it just possible to do this for the underarm or the palms on the soles? And my answer is simply anywhere you've got skin and you've got a problem with sweating, this treatment can be applied. But of course, you ought to find a practitioner that understands the principle of the treatment, how to precisely place the injection so it stays in the skin and not go into the muscle. In my practice, I have treated very many different areas with Botox. This includes the scalp for people who sweat a lot, the forehead and the nose, the back for a lot of men especially who sweat and find their shirt and suit clinging to their back, the groin for people who sweat and get very damp in the groin, and of course the very standard areas that we know, which is the underarm, the palms and the soles. For the palm and the soles, even though the skin is thick, Botox is still a very effective treatment for excessive sweating. The only difference is, in this case, the anesthetic is applied by what you call a nerve block, so that the whole palm is numb and the whole sole as well can be numbed. The other question I'll quickly touch on here is the perception that if you reduce on sweating, are you not going to get hot, or will it be dangerous to your health? The simple answer is no. Treatment of excessive sweating with Botox implies treating localized areas. Even if you did the whole back, which is the largest area that I have done, this is only 18% of your body surface area. It means you still have the rest 82% that you can use to sweat and control your temperature. Places like the underarms, the palms and the soles actually are just about 1% of your body surface area, which means if you did your underarm, palms and soles together in one session, you would have done only 6%, leaving 94% for you to sweat from. Now the treatment is completed and the skin is thoroughly cleaned with a mixture of antibiotic cream and moisturizer applied. I hope you have enjoyed this video, and if you do, please give this a thumbs up, leave your comment, and even a thumbs down if you haven't, and please follow us on Facebook.